So two questions about urinary tract infection. First question, the nurse in the long-term care facilities is caring for a client with indwelling catheter. So the person or patient who have indwelling catheter, which preparation should the nurse order for the client? Number one, cranberry juice with breakfast. Number two, nitrofurantoin 100 milligram tablet. Vitamin C every night at bedtime. And golden seal 2 ml, right? So we know that cranberry juice has some indication if your patient have a urinary tract infection, because cranberry juice is acidic and will change the pH of the urine. This is our choice, but why? As I told you, cranberry juice is acidic and will change the pH of urine and making it harder for bacteria to survive in the environment. So it can be used prophylactically to prevent urinary tract infection, and it does not treat an infection. The nurse can arrange with a dietitian to include this in the client dieting plan. So number two, let me explain why it is not the answer. Nitrofurantoin, a sulfur drug, and nitrofurantoin is prescription medication that is used to treat the chronic UTI, but the nurse could not order this medication. Doctor should order it. And number three, vitamin C. So in a long-term care facilities, this over-the-counter vitamin would require in healthcare provider. And number four, the golden seal is a herbs or Chinese medicine, alternative medicine we use for urinary tract infection, but in a long-term care facilities, it would require an healthcare provider order. Next question, the male client is admitted to the medical floor with a diagnosis of pyelonephritis. It is the inflammation of kidney and pelvis. Which intervention should the nurse implement first? So your patient have a pyelonephritis. Which intervention should do first? Priority. Initiate IV access with 20 gauge catheter. Admin IV antibiotic within 2 hours of admission. Obtain the urine specimen for culture and sensitivity. And number four, notify the dietary department in order to the client regular diet. It is super easy question and it is super easy answer. A patient has a pyelonephritis, they do not need to start the IV access. They do not need to admin IV antibiotic. IV antibiotic, if in a very bad condition, patient are not able to take over the mouth, then you can go to. Obtain urine specimen for culture and sensitivity. It is the answer because patient need oral antibiotic, but what organism is infected, we need to evaluate first, right? So we choose the number three. The nurse should obtain a clear voided mid-stem specimen for culture and sensitivity before initiate the antibiotics, and this is the first intervention for this patient. And notify dietitian. Number 4, why we do not choose it? Because a diet order is not a priority over getting the treatment start. UTI or pyelonephritis in a man are difficult to treat and can be life-threatening because it is uncommon in case of man. What next? The client diagnosis with glomerulonephritis and receiving a medication, antibiotics, right? And these antibiotics receiving trimethoprim sulfa. So if your patient received this, which data indicate medication is effective? Number 1, urine specimen gravity 1.010. It is normal, right? Urinalysis within 35 white blood cell. Number 3, urine pH is 6.9. And number 4, negative urine leukocyte esterates. So question, which data indicate medication is working, effective? So number 1 first, the urine specific gravity can indicate dehydration or water intoxication. It indicates patient has a diabetes insipidus or diabetes mellitus, but it will not provide information about UTI or about the antibiotic trimethoprim sulfa work or does not work. So number 1 is not answer. Number 2, a microscopic value of 35 white blood cell per high power field, shortly called HPF. It is indicate patient has a UTI, right? Because WBC in urine indicate the UTI. So not that the antibiotic is effective. It does not show that. And normal value should be less than 5 white blood cell per high power field. And number 3, urine specific gravity 6.9. So normal urine specific gravity should be 5.0 to 9.0. But the pH does not elevate UTI. It does not roll. And number 4 is only one left, the negative urine leukocyte esterase. This indicate what medication is work. They said negative, right? So a negative urine leukocyte esterase indicate the antibiotics or trimethoprim sulfa is effective in the treating the infection. And leukocyte and nitrate are used to determine bacteria and other source of UTI. So number 4 is answer. The next question, the nurse is administering medication to client on a urology floor. Which medication should the nurse question? It is ceftriaxone to a client who is pregnant, or cephalexin to a client who is allergic to penicillin, trimethoprim sulfa to a client post of prosthetic surgery, and nitrofurantoin to a client diagnosed with urinary stasis. So which one you prefer? Which one you think it is the answer? So which one is doing something wrong? We need to explain. Number one said ceftriaxone. Ceftriaxone, a third generation cephalosporin, is in the pregnancy risk category B. No research has shown any harm to the fetus in human or animals. The nurse would not question because this medication. So pregnancy, you can take the ceftriaxone. It does not cause any problem. Number two, cephalexin to a client who has an allergy to penicillin. This is the answer. Why? If you know anybody have an allergy to penicillin or allergy to cephalosporin, second generation cephalosporin, we never ever give it to them. So a cross sensitivity exists in some client between penicillin and cephalosporin, such as cephalexin. This is the cephalexin. It is cephalosporin. The person who have an allergy to penicillin, they have also allergy to cephalosporin, and cephalexin is a cephalosporin. The nurse should assess the type of reaction that the client experienced when taking the penicillin. If the client indicate any symptom of any anaphylactic reaction because of medicine, the nurse would hold the medication and discuss the situation with the healthcare provider. So number two is our choice. Number three, trimethoprim sulfa to a client post-prosthetic surgery. There is no reason for the nurse to question about the trimethoprim sulfa. It is the sulfa antibiotics for a client who has had a prosthetic surgery. Drug of choice. Last one, nitrofurantoin to a client diagnosed with urinary stasis. And also, there are no reason for the nurse to question about the nitrofurantoin. Nitrofurantoin is we used for prevention chronic urinary infection. So answer should be this.